There are so many opioid-related deaths in St. Louis County, a new medical examiner's office may be needed. County Executive Sam Page says there isn't enough room to keep up with the death toll. Our Justina Cornell learned more about their efforts and joins us now with details. Justina.
Yeah, Mike, so 2020 marked the first time there were more than 300 opioid-related deaths in St. Louis County. In 2021, that number hit a record of 343. With so many deaths, the medical examiner's office is overwhelmed, and Sam Page says a new facility could relieve some of that pressure.
The pandemic appears to have impacted the number of overdoses and deaths tied to opioids.
An opioid epidemic within a pandemic. It's a battle both the country and the St. Louis area face. So much so, St. Louis County is seeing record numbers.
There were 343 opioid-related deaths in 2021, and of those deaths, 94.5% involved fentanyl.
The Drug Enforcement Administration St. Louis Division reports it seized a record amount of fentanyl last year. To curb this problem, the county's health department is rolling out several measures. In the meantime, it tries to keep up. We're told the medical examiner's office is swamped.
The medical examiner's office is crowded because they don't have enough room to process all of the folks that are coming through. Chronic shortages of space means that the bodies of individuals are often being stacked upon one another.
More space could also bring some comfort to families.
Grieving families who come to identify a loved one share a tiny lobby with delivery drivers and anyone else entering the building, making those emotional moments that much harder for relatives.
That's why County Executive Dr. Sam Page says they plan to ask for a new building. However, the influx isn't just being seen here. Agencies such as the Queen of Peace Center are trying to combat this problem as well.
We provide family-centered behavioral health care for women with substance use disorders, their children, and their families.
Assisting women and pregnant moms, the organization serves up to $1,200 a year.
We're definitely seeing a greater need for services.
They too try to keep up in order to help anyone needing support.
We're definitely seeing an increase in individuals with opioid use disorders. So about 60% of the clients that we see are using opioids.
As far as other measures rolling out in St. Louis County, the Department of Public Health is working on a 2-year opioid action plan to raise awareness, boost prevention services, and expand treatment. The goal is to also distribute more Narcan to the community in the coming months.
Now to a developing